You did the root canal, you followed every instruction, you were extremely careful. Even after the entire procedure was done seamlessly, you still seem to have pain, and you are now starting to think, did something go wrong? Is there something you could have done to prevent it? I will tell you today what are the common reasons for having pain after root canal, and when you need to worry, when you need not worry, and all and more in this video today. Hi, I'm Dr. Salman. I'm a dental specialist orthodontist practicing here in Bangalore for the past 15 years. Welcome back to my YouTube channel. I post week on week helpful dental advice, straight talk to the patients. If you find my content useful, do consider subscribing to my channel. Without further ado, let's jump right into the topic. So what kind of pain is actually normal after a root canal? So I always tell the patients immediately post-op procedure, between 24 to 72 hours, sometimes there is a flare-up, meaning because we use these files in your canals, and that's the procedure is called as instrumentation or a BMP. During this procedure, when we are cleaning your canals and shaping them, all of these files working in your canal over time can lead to a little fatigue in your canals that can lead to a little pain. Sometimes the pain can be severe immediately right after doing the procedure, but then slowly over a period of 24 hours, 48 hours, 72 hours after you've taken the medication and followed all the instructions, the pain should start going down. So let's say on day 1, if your pain on a scale of 1 to 10 is 10, after 3 days it should be like 3 out of 10, and then maybe after a week it should be completely 0. So that is what a normal sequelae of a post root canal pain looks like. But when do you have to actually worry? What are the red flags in a root canal pain? So one common red flag is after you've done the root canal, even after a week, the pain now which has gone down has now suddenly started escalating. The pain is starting to get worse and worse. A swelling which was not there before, suddenly now it becomes evident. Then day by day you see swelling increasing. You have a throbbing kind of pain, pulsing kind of pain, and then suddenly you have pus discharge from the tooth. You also develop fever or facial puffiness. These are all the signs when, like, you need to go back to your dentist and tell that something's wrong, I need to get checked, the pain is not subsiding and discomfort is increasing. What can you do immediately when you're in this situation? Number 1, stick to your prescription, stick to your post-op instructions, take your medications on time. Avoid chewing anything hard on that side. Avoid eating anything hard, hot, spicy. All of these 3 things can trigger pain and can make the pain even more intense. Stick to using warm salt water rinses. Keep the areas saline and clean, and remember, never delay in getting your crown once the root canal has been done. Always remember, the root canal is step 1 of the procedure. The root canal actually gets completed and is called successful once the tooth has been crowned. Well, most of the root canals require crowns. I will make a separate video where when there can be root canals without crowns. If you're interested in such a video, do drop in comments and let me know. Now let's talk about what are the reasons that lead to this pain where it has gotten worse and you need to go to your dentist and get checked again, and what these pain means and what are the next steps. So I'll talk about the most common problems that lead to post root canal pain which is not getting fixed, and again it needs further intervention. Number 1 is missed canal. So let's say your tooth has 4 or 5 canals and the dentist has straight away missed filling one of the canals. So 4 canals are filled and one of them is missed, and the missed canal now is leading to bacterial proliferation and which leads to pain. Number 2 is while doing instrumentation or you have bitten on something hard, the root canal tooth is now fractured. When you have a fracture, that can turn into painful procedure and it will give you painful symptoms, but sorry to say, if it's a fracture, it can be detected during a X-ray. Sometimes even on the X-ray it may not show up, so then we recommend to get a CBCT scan done, and in the scan, if it shows fracture, most probably that tooth now needs extraction. Number 3, you have bitten on something very hard and you've not followed the instructions. Sometimes the patients are adamant, they don't stick to instructions, they don't take the antibiotics, they don't take the painkiller, and suddenly sharp shooting pain comes back. So if that's the cause, stick to your instructions, go back to your dentist, get the medication again and start following the medication. Number 4, you have not placed the crown. See, we finished the root canal. I always tell the patients we will give it a week to 10 days. Once your pain is completely gone, we have to crown it as soon as possible. See, when the tooth is not having a crown, it is vulnerable to many things. It can go for a fracture, it can get reinfected, there can be leakage inside. Once the leakage has happened or it's got reinfected, it needs to be root canal treated. If not, if it goes for a fracture, then you have left no option but to extract the tooth. And quite common in elderly patients, there is delayed healing, especially when they have diabetes, they have uncontrolled diabetes, and they have hypertension. These kind of medically compromised patients, the healing does not happen within 3 to 4 days. Sometimes it may take a week, sometimes it may take a couple of weeks, sometimes it may take a little more than that. In that, it's best to wait out and get a periodical review with your dentist until you are completely pain-free. So when the retreatment is really needed, see, like I told you, in some cases where the canal has been mixed, or there is a reinfection, or there is a leakage, then it will require a root canal treatment. Sometimes if partial tooth is fractured, we do a procedure called as apicectomy, right? And sometimes if there is a proper horizontal fracture, then the only thing that is left is we have to do an extraction. You can't do anything else. So my final thoughts are, tooth pain after a root canal doesn't always mean that it's a failure, and doesn't always mean that you need to get retreatment done. There are different conditions where I've already explained you. Some of the pain will heal over time, but some pain may require attention. So if you see some of the red flags that I have mentioned, you need to go visit your dentist immediately. But remember, the sooner you act, the easier it is to fix it. If you left it unchecked, then the problem is going to get more and more complex. Share this with someone who's very nervous about getting his root canal done, or you think is suffering from pain after getting the root canal done. And do subscribe to my channel for more such honest dental videos week on week. Until then, goodbye.